Thank you so much for being here. I just wanted to, first of all, acknowledge Catherine, who some of you have come to know over the last few months. Couldn't be with us today. We want to wish her a quick recovery. She wasn't feeling well. But I want to take a moment to just acknowledge that it's Catherine Spear, who is thermography clinic owner in New Brunswick, who spearheaded this whole project to have a monthly webinar series for practitioners. So just really, thank her, and we can all really give her thanks for getting this all started. I'm very excited to say we have a lot of people who participate from different parts of the world, and it's really inspiring. So while we've been able to provide you with this excellent information that hopefully will empower you in your work as a practitioner. Those of you who are not practitioners, we hope this will empower you in your own health or empower you to share this with your practitioners. We also thank you for being here, because the feedback we get, the attendance we get really does inspire us back. So it's really a back and forth inspiration. So thank you for who you are. Thank you for caring and being here. So on that note, I want to turn things over to Dr. Mostovoy, who's going to be leading this session today. And if you have any questions, you can put it into the chat box. I will be checking it. And we are going to take questions at the end.
Okay, thank you, Tally.
You're welcome.
And once again, welcome back for those who have been with us before, and for everybody who is new to this, welcome back. We're welcoming you to a whole new series. This month, we're going to be talking about diabetes. We're going to be talking about thermal imaging and diabetic foot. And specifically, how can thermal imaging can be used, not just for diabetics, but also for people who are in a pre-diabetic state. But primarily, it's going to be very, very, I think, useful for practitioners, as well as people who unfortunately suffer with diabetes, to see where thermography can fit in terms of their clinical practice. So without further ado, let's start. We are, just one second, here we are. So what I wanted to kind of, by kind of a brief introduction, what's going on with diabetes. As you can see, just a couple of years ago, in 2019, very famous year for a different reason, we had close to 1 billion people worldwide suffering from diabetes. It's probably overtaking just about anything out there as far as chronic condition or chronic disease is concerned. Very shortly, I know time is starting to run faster and faster, at least for most of us. In 2030, we're looking at projected 1.2 billion people, and not that far away, in just about 20 years from now, we're looking at about 1.4 billion people suffering from diabetes worldwide. Now, obviously, it's a big concern because it covers, at least today, it covers about 1 in 8 people worldwide. If we're looking at 8 billion people or somewhere close to that, 1 in 8 people in this world are suffering from diabetes, which is astounding. So what I'd like to show you is basically, where is it all coming from? So diabetes, as everybody knows, it's a group of metabolic disorders. that's dealing with high glucose levels in our blood. And the regulation of blood glucose is obviously essential to avoid any development of pathological conditions. So what happens there, either it's hyper or hypoglycemia. Now, when it comes to diabetes and hyperglycemia, where glucose levels are naturally elevated, and it's leading to functional and structural disruptions in the blood vessels themselves. Why is it so important? Is because we are looking at a lot of anomalies that major organs are affected by this disruption to micro as well as microcirculation. Now, that can lead to different things like peripheral neuropathies, poor wound healing, chronic neuropathy, coronary artery disease, cerebral vascular disease, even kidney disease is also implicated in this condition. So the diabetic neuropathy is probably one of the major concerns because it affects the nerve fibers in the lower limbs of the body. So persistently high levels of blood glucose levels basically are not only destroying the microcirculation, but also affecting the nerve fibers as well. What is that leading to? So as I said, on one hand, it may lead to neuropathy. On the other hand, it could also lead to ulcers. And these ulcers could be either ischemic as well as neuropathic conditions. And usually they will be affected in lower extremities. Once the bacterial infection sets in, you're looking at deep tissue destruction. So why is this important for us? Because naturally we can kind of use thermography looking at different parts of the body. But specifically when it comes to diabetes, it's very important to identify the major kind of players, if you like, what's going to create potential problems. So we're looking here at, as you can see on your screen, at healthy as well as diabetic blood vessels. So here, as you can see, it's much wider. And there is low compliance. In other words, that's a damaged blood vessel. That's just a very quick illustration. So as an introduction, when we're looking at using thermography with lower extremities, we're basically looking at vascular distribution. And we're using the infrared thermography to explore the challenges in diagnosing complications that involve temperature differences, because vasculature is going to involve temperature difference. And that's where thermography is ideal, because naturally it's kind of measuring that temperature. Now, it's crucial, as I mentioned before, to identify diabetic ulcers. And usually where they occur, they usually will occur on the plantar region of the foot. And what's unfortunate is that they're usually missed either by physical examination or even when somebody is kind of looking at it from regular kind of imaging, they're completely missed because they're not looking at temperature change. And I'll show you with some illustration exactly what happens. So if we can detect these onset of ulcers early enough, then naturally we can treat them and heal them before damage occurs. And that's where thermography is playing a crucial role in early stage of ulcer development, okay? Here's another illustration where you can see a reduced blood flow, okay, that leads to nerve damage. It could also lead to ulcers. It could also lead to dry, cracked skin. Now, not everyone who has dry, cracked skin at the bottom of their feet is not necessarily diabetic, but the dry, cracked skin allows infections to set in, and that creates a major, major problem. The ulcerations may even lead to amputations. And as we all know, that the diabetics basically don't heal as well, again, because of the blood supply has been compromised in some of these areas. So thermal imaging basically can help us look at ischemia, which is narrowing of the blood vessels, and neuropathy that affect temperature regulation in the foot. And we can establish a critical clinical marker for diabetic neuropathy. Again, I'm just setting the stage so that you understand when I'm going to be showing you some real examples. So the assessment of these subtle changes will help identify pathological conditions in much earlier stage. And that's the whole point of this exercise. And that is naturally is going to decrease patients' suffering and, of course, morbidity as well. So the human body, as many of you know, typically regulates and maintains normal body temperature with a very, very narrow range, even despite kind of ambient influences. So when we see a substantial difference between 2 feet, we're going to raise a red flag very, very kind of early, because it's not really visible with our kind of normal vision. Now, thermal regulation naturally is going to be affected by neuropathic pathologies, by inflammation, by peripheral arterial disease. And that's exactly what we're talking about, because diabetes is going to lead to peripheral arterial disease. So studies have shown that diabetic foot ulcers are characterized by lower temperatures than those of the plantar foot, okay? Again, another illustration here, we see a normal artery here, and we see atherosclerotic artery with plaque illustrated here. As I was preparing for this webinar, I was actually amazed at the literature available when it comes to diabetes, and specifically thermal imaging. I didn't expect there to be so much already kind of researched and published. Naturally, it's, you know, anything that affects close to or 1 billion people is going to get a lot of attention. But I really was surprised how many people were publishing and studying the subject using thermal imaging or infrared imaging technology. So here is, I'd like you to take a look at where exactly problem points are going to occur. So we're looking at plantar side of our foot, and you're going to see that it may be kind of in the big toe here, in and around this area, under here, as well as in the area of the heel. So those are the areas that we're going to be focusing on when we're looking at someone's image. Now, the normal temperature between right and left foot should not deviate more than 1 degree Celsius. So when we see a deviation of the foot or any point of interest in around 2.2 degrees Celsius, naturally, we're going to be concerned because that may lead to very, very quick development of ulcer. And I know this is not a pretty picture, but that's what a foot ulcer looks like. It's, well, naturally, it's going to be very painful, but it's going to be very dangerous because, as I said, as bacteria may set in, this can develop very, very quickly into much more kind of problematic issues that we see now. As you can see, at least there's still enough blood supply in and around the ulcer. The ulcer is not going to be healing very well, again, because there's a compromised kind of vascular supply to that area because of diabetes. But that can change very quickly. You'll see here, for instance, I don't know if you can see all of this well on your screen, but this is a rapid progression of infection in neuropathic as well as ischemic foot. So let's say on Monday, here's a person with neuropathic condition, and on the right side of your screen, you'll see a person with ischemic condition. This is Monday. And let's say there is a crack or a break in the skin, on Tuesday, here as well as here. By Wednesday, a serious infection sets in, both on the right as well as on the left. And by Thursday, gangrene sets in. And that's not a pretty picture because by Friday, foot amputation is already required. So we're looking at about within less than a week, something can progress from, I don't want to say normal, but from at least not an emergency situation to a critical thing that can lead to amputation. So that's why it's very important to kind of use any type of testing or technology to be able to avoid all these complications. So how do we do this? That's the general positioning when we screen people. Usually that comes with lower body kind of exam that we do. As you can see, we do dorsal view as well as plantar view. Okay. For those of you who are not familiar with thermal imaging, let me just take a second and explain. On the right side of your screen, you're looking at a color scale. These numbers are degrees in Celsius. So darker colors are cooler temperatures, lighter colors are warmer temperatures. So for instance, this particular spot right here is probably around 32 degrees Celsius. Whereas the toes that you don't really see, they're there. They may be about 26, 27 degrees Celsius. It's quite a difference in one foot just to begin with. But when we compare, let's say, this area to this area, as I mentioned before, anything within 1 degree or under is considered to be still within the normal limit. Anything over 1 degree, now we're starting to look at possibly some kind of, maybe there is arthritis that's setting in this particular area, or something else that's going on that we can investigate further if we need to. Now, since we're talking about plantar feet primarily, as I mentioned before, that colder temperatures are going to be in ischemic cases. Remember, ischemia is narrowing of the blood vessels. So naturally, that's going to be cold. Whereas warmer temperatures are going to be in neuropathic cases. So we're looking at this area here. Remember the picture that I've shown you where potentially are the most problematic areas could be, and that coincides with this particular area here, this region here, and this region on this foot as well. So that's a start. Now, this is another view, and as you can see here, we're looking at, again, difference in temperature between right and left. So here we have 28 degrees, here we have 30.7 degrees. Definitely this area is much, much warmer. What does that tell us? That tells us that there's something that's going on with this foot. And you know, just as you can see here, this toe, although the temperature is not taken there, but this toe is much, much warmer than this particular toe. So just visually, we can see that this one is probably about 26, 20, maybe 27 degrees, whereas this one is most likely going to be 25 degrees. That's a 2-degree difference. That's very, very problematic. So again, if this person is diabetic, already has been diagnosed, we would definitely watch them like a hawk so that they don't develop any kind of ulcer, or most likely they already have some form of neuropathy or neuropathic kind of symptoms. And if not, most likely they will develop them very, very quickly. So here is, again, an illustration of healthy versus diabetic. So the butterfly pattern is generally considered to be a healthy pattern. So we see this is what we would call a butterfly pattern. Distribution here and here is fairly symmetrical. Fair symmetry noted in these areas as well. Now, this maybe is a little harder for you to see, but this one is much, much warmer than the opposite side. And here, there is absence of the butterfly pattern. And again, presence in hypothermia in toes. And most likely, this is already a diabetic person. So what kind of complications could we see with diabetic patients? Again, we're looking at ischemia or coldness on one side versus the other side. This is diabetic without complications. Not every diabetic will have complications. But again, if they don't have complications, we want to regularly see if they're staying stable or if something is shifting. And finally, again, this is a healthy kind of image. Both feet are fairly symmetrical with that butterfly pattern. Here's another area. Remember, again, we're looking at certain points where we want to see very little difference in terms of temperature between right and left foot. And these are the points that we want to kind of take a look, measure them, compare them to the opposite side. So just to make sure that there is a healthy thermal distribution. Okay. Now, here's bilateral neuropathy. In this particular case, we see that some of the toes here and some of the toes here probably affected by neuropathy, as well as this area here, as well as ischemia in and around the toe of this particular foot. Okay, so again, when we see something like this, this may not be visible, may not be, for sure, it's not going to be visible just with the naked eye. So you need to use thermal imaging to assess proper temperature kind of difference. Now, you may feel it, maybe, you know, if you touch the foot, it may feel a little warmer than the opposite side, great. But I don't think that is going to be a very accurate assessment. And in some cases, you may not feel the difference that exceeds 1 degree Celsius just by physical exam. Patient with diabetes with acute inflammation of neuropathic foot. Again, we're looking at this particular area here, right? So again, in comparison, it's quite significant difference, and changing the difference in temperatures here is quite significant. So I think everybody can see that. Here's another illustration of bilateral peripheral angiopathy, which is worse on the left side, right? So here we're looking at the left foot. Same thing here. Again, it's cool. This is warmer. All we have to do is just take a look, take an image, take a look. Sometimes you don't even need to measure the difference. You can see that it's quite dramatic. Thermal imaging versus kind of MRI results. In this particular case, the MRI confirms what we have found, with thermal imaging. You can see here, for instance, the difference in temperature, 30.4 degrees, 28.2 degrees, and that's 1 point. Another point here versus here. This is actually quite common that we see with our thermal imaging analysis. And here you can see that the MRI image also confirms the same finding that we have with thermography, right? It's probably a little easier and a little faster to do thermography than to do an MRI. I'm not trying to we're not trying to compete with any other technology. MRI is great, like any other imaging technology, but it has its own kind of strengths and weaknesses, just like thermal imaging as well. So basically, what I'm trying to get across here is that thermal image acquisition, we need to kind of open things up and see how we can screen people who are in a pre-diabetic and definitely who have diabetes and may develop these complications very, very quickly, and trying to avoid any kind of trauma that leads to ulcerations specifically. So the accurate measurements are very, very important in terms of how do you analyze whether certain medications work, maybe certain therapies don't work. Again, we can definitely screen the full body, but I find that just looking at plantar foot gives us enough information. All we want to do is just kind of avoid major complications. So the protocol that we have developed years ago, where, as I said, we've been doing this, in my case, it's coming up to 25 years. And I think that by now I'm kind of very comfortable looking at different parts of the body and trying to assess what's happening, which way the patient is moving. Are they stable? Are they getting better? Are they getting worse? In this particular case, as I said, we just want to make sure that they're not getting worse. If they're stable or getting better, that's great, bonus. And we definitely want to tell their practitioners or to patients themselves that whatever it is that you're doing, keep doing this because you seem to be improving. But as I said before, I know I'm reiterating this point many times, because getting to the point of gangrene is no fun. I have had experiences with some of my former patients from years ago where they got to that point, and it's really totally unnecessary. We can use this technology to try and avoid gangrene and subsequent amputations. So what are the challenges? As I mentioned before, all technologies have their strengths and weaknesses. The challenge is who is doing thermography, who is analyzing thermography, whether your the thermography technician is properly trained, what type of protocols they're using, who trained them, who is analyzing the images. So very, very important to have the right ambient temperature, because naturally, if you're outside or inside, if there's a particular there are rules that need to be followed. Relative humidity is also important. Camera position. I always kind of stress, especially the ones who are just starting out with thermography, that camera position is very, very important. And region of interest. How do we select the region of interest? Well, in many cases, people will come and say, this is basically what I'm looking for. Just to kind of narrow down to our subject here of diabetes. If they have diabetes, naturally, we're going to be looking at certain areas with way more interest. And that leads to, what's their medical history? Their medical history, if they have some, will give a person who is analyzing the image additional clues. The more information we have, the more accurate we can come back with pertinent information that your clinician or the patient will need to take away from a thermography report. So, that's, I think, self-evident. What is the metabolic rate? Naturally, if somebody is going to exercise just prior to imaging, it really is not going to work well, because it's going to raise their metabolic rate. Skin blood flow. Again, if we have a particular kind of a set of rules that we're asking people to adhere to prior to imaging. In other words, don't go running, don't take a hot bath prior to this, don't have hot drinks, don't have alcohol. So all these things are important. And why I'm bringing this up is because all of this can affect the imaging kind of results. And of course, I just kind of preceded myself by saying that physical activity naturally is going to affect the imaging result. So these are the challenging that we face on our end, and naturally we are asking for patients' compliance, that we have proper imaging coming in. Naturally, we'll have much better accuracy in terms of our analysis and reporting. So what are the, what should I say, important things in terms of detecting abnormality? And that goes not just for diabetic foot, that goes to just about everything that we do. Symmetry. Now, symmetry maybe in some artistic circles is considered to be boring, but when it comes to your health, it's the best thing that you have going for you. So particularly when we're looking at regions of interest, left and right foot in healthy subjects, symmetry is ideally, it's there, and therefore we have no concerns. Anything asymmetrical, whether it's cold or hot, is going to give us a clue of what else is going on there. So again, the temperature is considerably high in the plantar arch. Remember what I was talking about, the butterfly pattern is at least 1.5 degree higher compared to other regions of a particular foot, right? So that gives us an indication of some metabolic activity that's going on that may or may not be so-called within normal limits. So patients with diabetic foot will have higher temperatures in the region of complication. I think that's self-evident. As I said, it could be 2.2 degrees or 2 degrees. The difference is not that significant, but definitely anything around 2 degrees or over, we're looking at some kind of a complication, maybe potentially kind of, again, neuropathy, or the opposite side, ischemia. So just looking at the plantar foot temperature gives us a lot of information how you regulate, how the body regulates temperature, and what is the cause. Okay, so the cause in this particular case, we're talking about diabetes, but it could be things like, even plantar fasciitis. And by the way, I see that with women's feet, probably 30 to 40% of people that come to us and do lower body examination, we see quite a significant number will have plantar fasciitis. It could be very painful, maybe nothing to do with diabetes, but it's a painful condition, and again, it could be treated, it could be remedied, but it's quite prevalent out there. So naturally, there is a wider variation of temperature differences between diabetic patients and healthy subjects. Okay. So in conclusion, what I'd like to to mention here is that thermography can and should be used as a diagnostic tool as well as prognostic tool for diabetes. Unfortunately, most of the people out there, and I'm talking about clinicians, are completely ignorant about the subject. And I said, unfortunately. So I'm hoping that if you're watching this, you've gathered some ideas and some information. I'd be happy to hear from you. And if you are not a clinician or a practitioner, maybe you can send this presentation to your clinician or to your practitioner, just to give them an idea. If they're dealing with diabetes, this is an indispensable tool, because all we have to do is just take an image, look at the temperature difference, and we can quickly establish who is at risk, who has a problem, and who is still within kind of normal limit. Here are the references. Now, I didn't want to kind of bore you with all the references that are out there, but these are some of the references that I used for this particular presentation. So you can see there's a lot of literature out there on diabetes and skin temperature, specifically using thermal imaging. What are the key takeaways? So again, it's very, very useful in clinical management. Okay, so there's no excuses now to say I didn't know about this. Now you know. Why is it useful? Because it helps you detect complications. And by detecting complications, you can prevent. And by detecting complications, you don't have to let certain things kind of occur, because you can treat this very, very quickly. The main emphasis here, of course, is to reduce amputations. In some cases, as I mentioned, thermography could be used as a prognostic indicator. So maybe your blood samples are not showing kind of diabetic markers that exceed normal. But if we're looking at your feet, and this is giving us an indication that something is going on, I would recheck your blood markers for diabetes. And again, maybe you can start something that will help you avoid getting those blood markers that are going to exceed so-called normal parameters. As you all know, thermography is a non-invasive method, so we don't need to X-ray a patient, we don't need to touch them. we don't need to hang them upside down. It's very comfortable. It's done very quickly, and it's very economical as well. The main thing is not only to establish a baseline, but also once the baseline is established, is to have a regular follow-up. Now, naturally, for someone who is at high risk, follow-up is going to be fairly frequent, especially for diabetics who are very prone to establishing ulcers. I'd ask them maybe to do it every couple of months to make sure that we're not missing anything. But for healthy individuals, once a year is good enough. And again, if we see any deviation between the baseline, assuming it's normal, and all of a sudden something is developing, whether it's developing in your foot, in your knee, in your elbow, in your breast, in your thyroid area, any change from that baseline is going to indicate to us that something is changing. And we're going to warn the patient and their practitioner, hey, look at this, something is up. Let's look at this maybe from a different point of view, or investigate this a little bit further. So in summary, and I want to kind of give a little kind of introduction to Canadian Association of Clinical Thermography, because as you can see, each and every month we're looking at different pathology and how to integrate that in general healthcare so that both individuals and professionals can use thermography. We are definitely dedicated to equipping you, practitioners, as well as non-practitioners, with knowledge. And the reason is naturally we want to enhance patient care. As I said, 1 billion people suffering from diabetes is just, I just can't comprehend this. Thermal imaging holds definitely transformative potential in healthcare, and we're definitely eager to share our knowledge, our experience, and help you as practitioners as well as individuals kind of utilize this tool. If you have any questions, as I said, we'll be very happy to connect with you, to hear from you. You can connect with connect@thermographycanada.com. You can use the phone number here. And at this point in time, I think we'll have maybe a few minutes to finish with Q&A.
Great. Thank you so much. That was so informative. I do have a couple of questions here. But before I read them, I wanted to remind you that if you do have a question, just go down to the bottom of your screen where you see chat, and you just click on it, and you can type a message in there, and it'll come into us, and I can ask it for you. Okay, so how can someone get thermal imaging or thermography the way you're talking about it?
I'm not sure I understand the question.
I think where do they go? Like how do
I
they,
see.
I guess it's maybe new for
I
them.
don't know where you are located, but if you go to our general website called thermographycanada.com, or if you go to thermographyclinic.com, you will see our affiliate clinics, mostly Canada, North America, US, some in South America. And if you don't find it kind of close enough for you, give us a call or contact us, and we'll try and find thermography kind of practitioners that are located close to you. Again, I can only vouch for people that have been properly trained, who are members of the Canadian Association of Clinical Thermography. Not to say that other people are not properly trained, but again, I just don't know who's doing what out there. But if you're close enough, I welcome you to one of our affiliate or satellite clinics, and definitely that's exactly what we do.
Great. And okay, so you said that the feet are the most important part to image. So what is the exam that people should do to get the feet included?
Right. Lower body imaging. So you have upper body that will look at the kind of upper back, hands, feet, neck. Sorry, I didn't mean to say feet. And then lower body will include this particular imaging as well. It's like full spine, lower spine. You're looking at gait views. So anyone with diabetes should be looking at plantar as well as dorsal imaging, and that
Okay,
would be in the lower body.
great. Okay, great. And someone is asking roughly how much would a regular evaluation of feet be for a person with diabetes? And then do insurance companies cover this?
Mhm. Some insurance do cover this depending on your insurance coverage. So what generally it's $295. That includes, I don't remember exactly, I think 14 or 16 images. We don't just look at feet, we look at the full spine, we'll look at gait views, we'll look at thighs, we'll look at knees specifically. That also gives me, as an evaluator, that gives me kind of an idea. I was just kind of finishing a report prior to this, but I see a lot of people looking at their spine. I see one or the other shoulder kind of drop. Okay, that shoulder drop is indicative of something. Now, it could be scoliosis where the spine is taking a curvature, but it also could mean something is affecting this person where they're almost like this. Sometimes it's an inch, sometimes even 2 inches lower than the opposite side. So what does it do? Naturally, of course, it's pulling person to one side versus the other. Now it's going to put more weight on hip joints. So it's going to put a downward pressure on the same side on that hip joint, and it's going to put upward pressure on the opposite side. So now this person is completely misaligned, and that creates even more complications because with more weight distribution on one side versus the other side, it's not just the hip. Now we can see kind of how it affects the entire kind of body of that person. And it's not surprising, especially if they're prone to diabetes, for them because of that weight distribution to develop some kind of neurological or ischemic complications if they're kind of like in the pre-diabetes thing condition, that just the weight distribution alone is going to be kind of put more risk on that side as well. So that's the full body. Sorry, not the full body. That's the lower body exam.
That's great. So that's so the lower body exam, just to reiterate, is the full spine, the
Yeah,
lower spine, the legs in different positions, upper legs, lower legs,
yeah,
and then the feet, both the dorsal and the plantar positions. And that's 295
right.
for the imaging, the report, and speaking to whoever did your imaging, they will go through the report with you.
Correct.
Great. Okay. Well, that's it for questions for today. So thank you everybody who submitted your questions. If you realize after that you have a question and you didn't think about it at the time, then please feel free to email us at connect@thermographycanada.com. That is the Canadian Association for Clinical Thermography email. And we look forward to seeing you next month. The next month is going to be, I
My
should have
favorite
had this.
subject.
Next month is going to be, hormones. And we're looking at that on February 21st, Wednesday, February 21st. All right, until then, all the best. Oh, just a moment, I'm sorry.
One more question?
I see someone put a question in a different spot. Does thermography detect frostbite? Is any effort being made to get this covered for those who do not have the funds? So frostbite.
Yeah,
That's an
naturally,
interesting question.
frostbite is going to present with very, very kind of different temperature. The whole point here is temperature, a kind of difference between 2 points of reference, what we call delta T, right? So let's say we have 2 fingers. So if I have a frostbite here and not there, naturally it's going to be different temperatures. Yes, but I think anyone with frostbite doesn't need thermography. They'll probably feel it quite well. But if you want to see whether or not there are kind of further complications, yes, definitely. Thermography can help you identify if it turns into something long-standing or chronic condition.
Great. And then someone just asked, do you need to do MRI to confirm the result too?
No, you don't need to do MRI. I mean, you're certainly welcome to, but as I said, when we're talking about specifically diabetes, all we want to do is to make sure that we are early enough in terms of raising a red flag that there are complications here that may lead to ulceration, okay? Because ulceration is going to be very, very dangerous. And if, let's say, ulceration is already there, then we want to, again, image to make sure that it's being treated properly and the patient is moving in the right direction. So what I mean by that is that if it's becoming closer and closer in terms of temperature to the opposite side, then we know that it's healing well. But as we all know, that diabetic ulcers don't heal well, and that potentially creates kind of a very, very high risk for complications.
Thank you so much. That's great. Someone typed in another question. I just typed a response to you. Just with the time, we're going to close now. It's been an hour. We thank you for your time. And if I didn't get to a question of yours, please send it to us at our email and we'll get back to you by email. All the best, everybody.
Thank you.
The Canadian Association of Clinical Thermography is dedicated to making thermography more accessible and available to those who seek it. Become a supporting member today and help us transform the way medical thermography is understood in our world by practitioners and the general public. Visit us today and join us.